safety and infection control in healthcare. First, we'll talk a little bit about the role of regulatory agencies in ensuring a safe environment for workers. We'll talk a little bit about the many safety precautions that are in place for both workers and for patient safety. And we'll also talk about the prevention of the spread of disease, which is, of course, a primary concern in healthcare. The regulatory agencies that are most important for protecting worker safety is OSHA, or Occupational Health and Safety Administration. All workers have a right to a safe work environment, and there are laws that all employers have to follow and safety standards that must be enforced in every work environment. It's one of the reasons that students are not allowed to have food or drink in any of our lab spaces at North Country Community College. It's to ensure everyone's safety. OSHA's role is primarily in prevention. The CDC, or Center for Disease Control and Prevention, are primarily involved in preventing and controlling the spread of infectious disease. They're responsible for many public health advisories about washing hands or sneezing into your elbow or avoiding mosquitoes to prevent Zika virus. They also act on a national and global scale to help identify and control disease outbreaks. One of my college roommates is actually an epidemiologist at the CDC, and she's traveled around the U.S. to investigate salmonella outbreaks, and she's traveled to Africa to help control the recent Ebola outbreak, just to name a few of her travels. Exciting stuff. Proper safety precautions are important to protect both healthcare workers and patients. There are many hazards to healthcare workers who are exposed to dangerous chemicals, sharp tools, radiation, heavy lifting, irregular sleep patterns, and long hours on their feet. But there are also safety hazards to patients who may be weak or immunocompromised and exposed to bacteria from other patients or healthcare workers, and who are prone to slips and falls, or who may also be exposed to radiation, who are getting various medications, etc. Using proper sterile technique and other safety procedures ensures that patients will be safely cared for. So, some safety precautions surround medical equipment and chemicals that are used for treatment. Medical equipment and chemicals can pose safety hazards. Too many machines plugged into an outlet could generate a spark that ignites a fire. Oxygen, which is used in high concentration in respirators, is highly flammable. And even cleaning chemicals that facility staff use can be hazardous to a healthcare worker. So being aware of the hazard classifications of these different materials that you work with on a daily basis is really important for everyone's safety. Radiation is also a safety concern. Radiologic technologists and nuclear medicine techs can be exposed to radiation in their job and are also exposing patients to radiation. It's important that they and patients wear the necessary protective gear, like lead aprons, to prevent radiation-induced mutation in their reproductive cells. When possible, they will be located in a separate room space to minimize their exposure. Rad techs usually wear special badges that detect levels of radiation and change color if they have been overexposed. People don't often think of healthcare as a violent workplace, but there are many factors that can result in violence in a healthcare setting. Sometimes there's a presence of handguns or other weapons due to victims of violent crimes being treated in ERs. Sometimes you must care for acutely disturbed or violent individuals. Hospital pharmacies are a source of drugs and cash and are sometimes robbery targets. Long waits in an ER or clinic may result in disgruntled patients that can take out their frustration in a verbally or physically violent way. Patients who are emotionally distraught can also lose control of themselves and become violent. And many healthcare workers find themselves alone in a room with a patient. And for any Grey's Anatomy fans out there, you know what happened to Meredith Grey the time she was left in alone with a large man who had just had a seizure. Post-ictal or post-seizure patients are prone to violence. And if you aren't a Grey's Anatomy fan, you know you're totally going to Google that. Of course, a major part of healthcare involves treating infectious diseases that are caused by pathogens. Pathogens can be viruses, bacteria, fungi, protists, or worms that enter the body and cause disease. Not all pathogens are equally infectious or virulent. Many factors influence the spread of pathogens, including the size and length of time that you're exposed, the virulence of the pathogen, and the strength of one's immune system. A major problem in healthcare right now is the emergence of antibiotic-resistant bacteria. When antibiotics became available in the 1940s, they were miracle drugs. Infections that were once deadly became easily treatable. We are re-entering an era where infectious diseases are becoming untreatable due to the evolution of bacteria and the spread of antibiotic-resistant bacteria, such as MRSA, which is methicillin-resistant Staph aureus, and other strains of Staph aureus that are resistant to different antibiotics. Pathogens like viruses and bacteria can be spread many ways. One way is by direct transmission or direct contact with the source. Any kind of touching or sharing of bodily fluids with someone you are close to falls into this category. Indirect transmission is when you come into contact with the pathogen without actually coming into contact with the carrier. Thus, the disease is transmitted by an intermediate vector. So maybe you got bit by the same mosquito, or you touched the same doorknob, or you ate some food that they prepared. You didn't directly come into contact with the person who carried the pathogen, but you came into contact with something that they contacted. So carriers of disease are not always obvious. Sometimes a person who is sick is the source of disease, but sometimes there are people who act as asymptomatic carriers. A famous example of this was Typhoid Mary. She was a maid and a cook who happened to carry Salmonella typhi even though she didn't get sick from it. And she spread typhoid fever to all the homes that she worked in, resulting in the deaths of some of the family members that she worked for. When doctors realized that she was the source of these infections, she was actually quarantined for a period of time, a couple of years actually, and then she was released finally with instructions not to prepare food or work in food industry or people's homes. But she was arrested a couple of years later because she ended up taking a job at a hotel restaurant, and it resulted in more outbreaks of typhoid fever from Salmonella there. So in modern day healthcare, a big concern is not typhoid fever, but of course MRSA on the previous slide, multi-drug resistant Staph aureus strains. About 2% of our population are actually carriers for MRSA. They can unknowingly and asymptomatically carry it in their nasal passages and then pass it on to others. Furthermore, patients who are recovering from diseases can still transmit infections, and there are also many zoonoses, or diseases that are transmitted from infected animals or insects. So, although hospitals may seem like a very sterile environment, they're actually rife with infectious diseases. So much so that there's actually a special term for diseases acquired in a healthcare setting. They're called nosocomial infections. The four most common nosocomial infections are 1. Urinary tract infections, which are due to urinary catheters, which can introduce bacteria to the urinary tract. 2. Surgical site infections, in which bacteria get into open wounds from surgeries. 3. Pneumonia, in which bacteria are introduced through respiratory devices like intubation. And 4. Septicemia, or blood infections, which can be a serious complication of any of the above, of urinary tract infections or surgical site infections or pneumonia that's spread to the bloodstream. 2 particularly important types of diseases in healthcare facilities are those that are airborne and those that are bloodborne. Airborne diseases can be spread just by breathing the same air. Many hospitals have special air ventilation systems to prevent the spread of air from one room to another. In some cases, like TB, tuberculosis, they may have negative pressure rooms that keep all the air inside the room to prevent the spread of TB. Bloodborne pathogens are also of concern because many of them are chronic, deadly diseases with limited treatment options and no cures. Needle sticks can be a source of accidental infection, but so can unsafe handling of blood products. It is standard procedure to operate as if every patient and all blood samples contain bloodborne pathogens. These standard safety procedures are known as standard precautions. They include things like washing hands all the time, wearing appropriate PPE, using disposable tools rather than washing them, handling needles safely by not recapping them, because most accidental sticks come from recapping needles, and disposing of them in sharps containers rather than trash bags to prevent trash handlers from sticking themselves. And of course, not eating or drinking in lab spaces to prevent any possible chemical or biological contamination. A very important part of preventing spread of disease is constant hand washing. Before and after every patient contact, after any handling of bodily fluids or specimens, after you sneeze or go to the bathroom, before and after you eat, just a lot of hand washing. So not only does it ensure that you do not pick up pathogens from your patients, but also that your patients don't pick up pathogens from you. Another way to obliterate pathogens in a healthcare environment is with chemical cleaners. Many home-use cleaners are disinfectants, which means they kill most but not all of bacteria. Or they might be bacteriostatic, which means they inhibit growth, but they don't necessarily kill bacteria. The gold standard of cleanliness is not disinfection, but sterilization, or using germicidal techniques. There are germicidal chemicals that are used to clean surfaces, like bleach and some other things. But another common sterilization technique in healthcare is to use heat, using an autoclave or an oven to kill bacteria on surgical tools. In our modern age of plastics, another option is just to use disposable tools, so you can discard them instead of having to disinfect them. PPE is a common acronym that's used in many professional settings where personal protective equipment is required. In a healthcare setting, these often involve gloves, masks, gowns, booties, and protective eyewear. In something like construction, they would involve hard hats and steel-toed boots. So PPE is a term to know really in any profession. It stands for personal protective equipment. So once you've used all of the proper safety gear, it's also important that you dispose of it properly. Paper towels or plastic wrappers from syringes can go in the regular trash. But anything that's been contaminated with bodily fluids should go in a biohazard bag if it has vomit or blood or stool on it. And sharps, like needles and razors, should go in a sharps container to reduce the risk of accidental stabs. Hopefully, you are now more aware of some of the hazards that face healthcare workers and patients alike.